Hey guys, Dr. Q here, and today I'd like to talk a little bit about surgery for erectile dysfunction. Now, there are three types of penile prostheses we can place, and we'll talk about all three. So let's get into it. The first prosthetic is the three-piece prosthesis. Now, this is considered the Cadillac or the gold standard. So it is made of three components. You have a reservoir right here that sits behind the pubic bone and in front of the bladder. You have cylinders, and actually two of these, one to go in each erectile body. And then you have a pump that fits inside of the scrotum. And so basically how this works is you are transferring fluid from the reservoir to the cylinders with a pump. So when you want to have an erection, you simply squeeze the pump, which fits neatly next to your testicle, and fluid is being transferred through this tubing into the prosthetic, and you have an erection. Now, a lot of guys ask me, what size are you going to put in me? And the answer is, I don't know. We actually have to measure you. And so a lot of people don't know this, but the penis is a lot longer than you think. In fact, a lot of it is hidden. So if you look around here, this is about the point at which you can see the exposed penis, this length here. But if you look back here, you see the penis actually extends all the way back to the pubic bone. And so when we're sizing out a prosthesis, we have to measure the entire length to get our size for the prosthetic. And so we try to fit you with exactly what you need in your stretched length in order to maximize your size. So let's look at an actual prosthetic. So this is a sample of an actual penile prosthesis. Okay, so you see you have the cylinders here, and if you look carefully, you see that the shaft of the cylinder is very soft and pliable. The ends are a little different. The tips are harder, and these fit underneath the head of the penis to aid in penetration. And then you have something called rear tip extenders right here. And so these actually snap on the end of the prosthetic to fill in the rest of the length that we talked about that goes back to the pubic bone. You then have a pump that fits neatly inside the scrotum. And if you look closely, this pump has a little button. I don't know if you can see it there, but there's a button right here. Now that button is what you hit to release the valve to allow pressure, or allow the fluid rather, to go back from the prosthetic into the reservoir. Okay, and so you're just transferring fluid back and forth. So essentially, what this looks like is, if I give it a squeeze, you start to see that fluid slowly fills up the prosthetic. If you see that when I'm squeezing, I'm not going fast, I'm not pumping. I'm actually letting fluid, as I release, fill in the cylinders. As I'm doing that, you see the prosthetic is filling out. You see you have two, one on each side. And so this pump, you just basically pump until you can't pump anymore. Now there's no tissue around this, so I can pretty much pump indefinitely. But the prosthetic that I place expands in both length and girth to mimic your natural erection, okay? And so when you are done pumping, you have a rigid prosthetic here with a rigid tip to help with the penetration, but it's actually not as rigid here as it is on the tip, okay? So what your partner feels is actually you. It's a warm erection. They don't feel any of this inside, internally. And the beauty about this is that you have the sensation, you can have an orgasm, you can have ejaculation, everything is intact. The only difference is you won't go down after you have an orgasm. So you actually have to hit this button that we talked about right here. You press this button and you give the prosthetic a little squeeze, and the fluid actually goes back into the reservoir. And then that will complete the cycle. So it's gonna take a little while, but you get the gist. And so now you have in its flaccid state at this point. So that is a three-piece penile prosthesis in general. It is either an outpatient procedure or overnight stay. You can actually use it in 6 weeks after implantation. People ask, why do I have to wait 6 weeks to use this? And the reason being is that your body will actually form a capsule around the reservoir. And you want this to be done in its full state so that water can always transfer back into the reservoir without issues. So some people also ask, what are the risk factors with this procedure? Well, obviously, because it's mechanical, you can have mechanical failure of one or all components. You can also have erosion of the prosthetic. I had a patient who he had some mental challenges and he left his prosthetic up, and he left it up all the time. And so it eventually eroded through the end of his penis. And so that was not a good look for him. And because it's a foreign body, it can be infected or become infected, particularly if you're diabetic. And so if you do have diabetes and you need a prosthetic, you generally want to have your hemoglobin A1C below 7 before proceeding with this, because you are at higher risk for infection. So that's a 3-piece penile prosthesis in a nutshell. It has the highest patient and partner satisfaction rating. And if you are in the category where all else has failed, this is a great option. The second of the penile prostheses is actually the 2-piece prostheses. Now this is in a little saline pack in order to keep the fluid in it. But as you can see, there are only 2 components to this prosthesis. You have the cylinders and you have the pump/reservoir, okay? So in this situation, this is different than the 3-piece because you don't have the big reservoir. And because of that, there's always gonna be some fluid within the cylinders. And so that means you're always gonna have a partial erection. So if that is an issue for you, then this may not be your prosthetic of choice. So essentially, to activate this, and once these cylinders go in the corporal bodies, you press this button here, and it transfers the rest of the fluid that's in here into the prosthetic. You can see it didn't take many pumps, maybe 2 pumps to get it full. And so now you have your prosthetic that is full. It's pretty rigid. The tips are harder, just like in the 3-piece, to help facilitate penetration. And you have the ability to put rear tips on the back. So this is a 2-piece prosthetic. Men who I choose this prosthesis for are men who have had pelvic surgery, radiation, inguinal hernias with mesh, basically difficulty entering into that space of radius right behind the pubic bone in front of the bladder. And if that's the case, then this is the perfect prosthesis for you. The third option is the malleable prosthesis. And so this is all it is. There's actually 2 of these that you put in, 1 in each corporal body. And essentially you approach the penis the same way as far as measuring out both distally and proximally the length. And once you have that size, you basically cut the end of this according to the size, okay? And so your corporotomy, or the incision that you make in the penis, has to be a little bigger in order to accommodate this, because you actually have to bend it this way and stuff it in, and then it expands. And so obviously this is less desirable because it does not inflate or get larger in any dimension. It simply just is able to be malleable and to bend. And so it'll be straight enough to do the job, but no real frills or thrills with this, other than hopefully you will be able to achieve penetration with it. People who qualify for this are people who have had previous failures of prosthetics or erosions of the prostheses. And if so, then they cannot have another inflatable prosthetic. And so they would need this in order to prevent another erosion. So that's the prostheses world in a nutshell. So again, to review, you have the 3-piece, or the Cadillac, as we call it, with all 3 components. This is probably the most favorable prosthetic. If you can't have this, then you can do a two-piece prosthetic, which is also very satisfactory. And if all else fails, you can have a malleable. So that is my 2 cents on penile prostheses. I hope that was informative. So that wraps it up. If you have any further questions, feel free to DM me or call your local urologist for a consultation. Take care.